Diarrhea is one of the most common digestive problems experienced worldwide. Almost everyone has suffered from it at some point in life, whether due to food poisoning, viral infection, or chronic illness. While in many cases diarrhea is temporary and resolves without complications, it can sometimes be a warning sign of a more serious underlying condition that demands medical attention. Prolonged or severe diarrhea can lead to dehydration, malnutrition, and even life-threatening complications if left untreated. This detailed guide will explore diarrhea in depth: what it is, the causes, symptoms, diagnosis, and treatment options. We will also cover preventive strategies and when to seek urgent medical care. Diarrhea is defined as the passage of loose, watery stools 3 or more times per day. It is essentially the body's way of quickly expelling harmful substances, toxins, or pathogens from the digestive tract. In medical terms, diarrhea is categorized into different types. Acute diarrhea, sudden onset, lasts a few days, commonly caused by infections or food poisoning. Persistent diarrhea, lasts 2 to 4 weeks. Chronic diarrhea, lasts more than 4 weeks, often linked to underlying gastrointestinal disorders such as irritable bowel syndrome (IBS), Crohn's disease, or malabsorption syndromes. Diarrhea can range from mild and self-limiting to severe, requiring urgent medical intervention. Understanding its causes and risk factors helps in preventing complications. Diarrhea has numerous potential causes. These range from short-term infections to chronic medical conditions. Some of the most common causes include infectious causes, viral infections, rotavirus, common in children, norovirus, often linked to foodborne outbreaks in cruise ships, adenovirus and astrovirus, bacterial infections, Escherichia coli, E. coli, Salmonella, Shigella, Campylobacter. Clostridioides difficile, often occurs after antibiotic use, parasitic infections, Giardia lamblia, Entamoeba histolytica, Cryptosporidium. B. Food-related causes. Food poisoning from contaminated food or water. Food intolerances such as lactose intolerance, difficulty digesting dairy, or fructose malabsorption. Food allergies e.g., gluten and celiac disease. C. Medication-induced diarrhea. Antibiotics by disrupting normal gut bacteria. Magnesium-containing antacids. Chemotherapy drugs. Certain blood pressure medications. D. Chronic diseases. Irritable bowel syndrome (IBS). Inflammatory bowel disease, Crohn's disease, ulcerative colitis. Celiac disease. Pancreatic insufficiency, leading to poor digestion of fats. Endocrine disorders e.g. hyperthyroidism, diabetes. E. Other causes. Excessive alcohol consumption. Stress and anxiety can trigger functional diarrhea. Post-surgical complications e.g. after gallbladder removal. 3. Symptoms of diarrhea. Diarrhea is not just about watery stools. Depending on the cause, it may be accompanied by various symptoms that provide clues to its origin. Common symptoms: frequent loose, watery stools, abdominal cramps and pain, bloating and gas, nausea and vomiting, urgency to use the toilet. B. Signs of dehydration, serious warning signs. Diarrhea can quickly lead to dehydration, especially in children and older adults. Watch out for extreme thirst, dry mouth and tongue, reduced urination, dark urine or very little output, sunken eyes or cheeks, dizziness and weakness. In infants, dry diapers for several hours, irritability or lethargy. C. Red flag symptoms. Seek immediate medical help. Blood or pus in stool. Black, tarry stools indicating bleeding in the digestive tract. High fever, greater than 39 degrees Celsius or 102 degrees Fahrenheit. Severe abdominal pain. Diarrhea lasting longer than 2 weeks. Rapid weight loss. 4. Diagnosis of diarrhea. The diagnosis of diarrhea begins with a detailed medical history and physical examination. Doctors will usually ask about diet, recent travel, medications, and exposure to sick contacts. Medical history and physical exam. Duration and frequency of diarrhea. Presence of blood, mucus, or fat in stool. Associated symptoms: fever, vomiting, weight loss. Travel history, risk of traveler's diarrhea. Family history of gastrointestinal disorders. B. Laboratory tests. Stool analysis. Stool culture for bacteria, Salmonella, Shigella, Campylobacter. Ova and parasite test. C. Difficile toxin test. Fecal leukocytes or calprotectin indicate inflammation. Blood test. Complete blood count to detect infection or anemia. Electrolyte panel to assess dehydration and imbalances. Test for celiac disease, anti-TTG antibodies. C. Imaging and endoscopy if needed. Colonoscopy or sigmoidoscopy to examine bowel lining. CT scan or ultrasound for structural abnormalities. 5. Treatment of diarrhea. The treatment of diarrhea depends on its underlying cause. However, the primary goal in all cases is to prevent dehydration and restore fluid balance. General measures. Rehydration. Oral rehydration solution (ORS) is the cornerstone of treatment. It replaces lost fluids and electrolytes. In severe cases, intravenous fluids may be required. Dietary adjustments. Follow the brat diet, bananas, rice, applesauce, toast, during acute diarrhea. Avoid fatty, spicy, and sugary foods. Limit dairy and caffeine until recovery. Rest, giving the body time to fight infection is essential. B. Medications. Antidiarrheal agents, loperamide, bismuth subsalicylate. For non-infectious diarrhea. Antibiotics. Only for bacterial infections e.g. cholera, traveler's diarrhea, C. difficile. Not all diarrhea needs antibiotics. Probiotics help restore healthy gut bacteria, especially after antibiotic use. Specific treatments e.g. gluten-free diet for celiac disease, anti-inflammatory drugs for IBD. C. Treatment in children. Focus on oral rehydration solutions. Avoid over-the-counter antidiarrheal drugs unless prescribed by a pediatrician. Continue breastfeeding or formula feeding. 6. Complications of diarrhea. If untreated, diarrhea can lead to several serious complications. Dehydration, most common and dangerous complication. Electrolyte imbalances, loss of sodium, potassium, and bicarbonate may cause heart or muscle problems. Malnutrition, especially in children with chronic diarrhea. Sepsis, in cases of severe bacterial infection. Organ damage, prolonged dehydration can affect kidneys and heart. 7. Prevention of diarrhea. Prevention is key, especially in developing countries where diarrhea-related deaths are more common. Hygiene measures. Wash hands frequently with soap and water. Use clean, safe drinking water. Avoid food from unhygienic sources. Wash fruits and vegetables thoroughly. B. Vaccination. Rotavirus vaccine is effective in preventing severe diarrhea in children. C. Safe eating and travel habits. Boil it, cook it, peel it, or forget it rule when traveling. Avoid raw seafood or undercooked meat. Be cautious with street food in high-risk areas. While mild diarrhea often resolves on its own, seek immediate medical attention if you experience diarrhea lasting more than 3 days. Severe dehydration symptoms. high fever and bloody stools, chronic diarrhea with weight loss. Diarrhea in infants, elderly, or immunocompromised individuals. Most cases of acute diarrhea resolve within a few days with supportive care. However, chronic diarrhea may indicate serious underlying disease and requires long-term management. Early diagnosis and treatment improve prognosis and prevent complications. Diarrhea is a common condition, but it should not be ignored. While mild cases are usually harmless, prolonged or severe diarrhea can signal underlying medical problems that need urgent attention. Understanding the causes, symptoms, and treatments empowers individuals to take timely action and prevent complications. Practicing good hygiene, staying hydrated, eating safe foods, and seeking medical care when necessary are the best ways to manage and prevent diarrhea.